Hey everyone, just going live now. Wait for everything to catch up. So I'm going live on Facebook and Instagram. I couldn't figure out a way to do it from one device, so I'm doing it from Facebook on a laptop and Instagram on my phone to try and reach everyone. So if anything goes wrong, I do apologise, but hopefully I can make this work. If it looks like I'm looking at two different things, I'm trying to look at both cameras at the same time. So yeah, looking at that, I'm actually having some issues with the Facebook one already. Let's have a quick look. But yeah, here to talk about haemophilia, my experience on Hemlibra, answer any questions, and to talk about mental health. Thank you for everyone that's already joined. Cheers, Josh. Let's have a quick look who else has joined. And everyone else, hello. Thank you for joining. Thank you for commenting on how smart I look. So yeah, I'm just here to talk about haemophilia. So if anyone's got any questions, anything they want to talk about or ask me in regards to haemophilia, my current treatment, or anything like that, we'll have a look and see, and I'll see what I can answer. So thank you for everyone who's joined so far. Hopefully a few more people can join and ask some questions. I think I've already messed up because it looks like I'm streaming on my own Facebook as opposed to my unclockable one. So you know what, we're just going to close down the Facebook one for now. Falling at the first hurdle. Hang on. Let's have a quick look. I see another Haemophilia Society has joined us. Thank you very much for joining. And let's see. Technical difficulties. I do apologise. I'll wave to everyone. So whilst we're waiting, has anyone got any questions? Anything that I can talk about whilst I sort out my technical difficulties? Let's have a quick look. Matty, thank you for joining in, bro. Good to see you. Well, this is awkward, isn't it? Someone jump in with a question, please, so I don't start bricking it and end up cancelling this entire thing. I wanted to set this up because I completed a year on Hemlibra, and it seemed like a good idea to actually talk to people and share my experience on the treatment, as well as to talk about things that I'm working on, answer anyone's questions in regards to the treatment and haemophilia itself. So that was the whole point. The main reason, thank you Josh, giving me something to talk about, you legend. The main reason that I wanted to go on to Hemlibra was needle burden. I had so many issues with my previous treatment. I was on Refacto, prophylaxis and treating daily, and after I'm almost 30 now, so after sort of 30 years, it seemed like a good idea to go onto a subcutaneous treatment that would be less harmful on my veins and just take that burden away completely. So for me, it was an entire no-brainer. So I made the switch. It did not go as smoothly as I had planned, purely because I didn't anticipate the difficulties I might find switching from an injection that I was so used to a subcutaneous, to something that felt a little bit alien to me. And losing that kind of freedom that I would maybe have that I had before in my previous treatment. Sorry if I sound like I'm stuttering. I'm trying to set up the the one on Facebook at the same time. So I've just got another comment from there. They won't do the medication here. Where are you from? I want to try and say your name correctly. Your Insta name, Nay Capri. Where are you from? But yeah, so I decided to switch purely for needle burden point of view. Hopefully I'm going live on Facebook now. On Unclottable, we shall find out. Let's find out if it is actually Unclottable, if I've done it on my own personal Facebook again. Let's try not to get Canada. Ooh, I don't know how it works over in Canada, unfortunately. Here we go, we're live on Unclottable now as well, so hopefully I can talk to anyone. Josh, is there anything you'd warn against people moving to Hemlibra? I think the main thing is it comes down to personal preference on how your treatment works for you and what you're looking to achieve. Just because it's a new treatment doesn't necessarily mean it's better. It's a treatment that works and does help with bleeding disorders, and it does make things easier. But if you are actually comfortable and working well with your current treatment, then it might not necessarily be worth all the hassle of changing. Like I said, for me, I prided the personalisation that I had with my previous treatment, the fact that it allowed me to do the likes of Tough Mudder and get tattoos and things, and that I really liked that I had that with my treatment. But the needle burden was that much for me that I decided to change. So I kind of lost a little bit of that freedom. There's times where I have actually had bleeds on Hemlibra, nothing major, where I've then resulted in having to actually have normal factor. Then looking back on that situation, I kind of think, well, if I was still on my previous regime, I probably wouldn't have had to have that extra dose because I would have accounted for it in my personalisation. So it's all about what's going to work well for you. If you're happy on your current regime and it's giving you that protection and allowing you to do what you want to do, then it's entirely down to yourself whether it's worth making that swap or not. Obviously, I can't speak for other countries, but I know in the UK we are very fortunate in all the treatments that we have available to us through standard half-life, extend half-life, and these novel therapies with the likes of Hemlibra and these other treatments that are slowly coming out. That for once we've actually got a choice in what we can have and what we can use to tailor to our lifestyle. So it's all about finding the right kind of combination for what you want to do and what works best for you, what you're most comfortable with. The biggest thing that I've learned growing up is what's going to work well for my personal life, my work life, or education wise, what's going to work well within what I need to do. Is it going to help me doing well? Is it going to cover me for work? Is it going to cover me for everything I want to do outside of work? And try and get that balance. Changes hard for people. How would you encourage parents, patients and parents to do this? I mean, I can only speak as being a child myself and the decisions that my parents made with the treatments available for me at the time, and for most of my life it was standard half-life. But I think it's all about looking at what's going to be best for the person with the bleeding disorder, really. I've spoken to parents about switching to Hemlibra, and in my own personal view, I think if you've got a younger child, trying to find a vein, try to get them to sit still long enough to have an injection must be hard enough. So Hemlibra as that option is certainly beneficial in that aspect, but also learning how to inject into the vein is very important and very beneficial, because I've been on it a year and I've already had to do factor treatments. Not everyone will, and not everyone will be as stupid as me and doing things that they probably shouldn't do. But being able to do that as and when I've needed to has saved me trips back to the hospital. So you wouldn't want people growing up on Hemlibra and then all of a sudden having a bleed and needing some factor and not being able to do it. So it is weighing up the pros and cons of that. But with the likes of Hemlibra, you don't really need it with the likes of inhibitors and things like that. So you do have some benefits. But again, it's looking at what your child is doing and what your consultant's telling you as well. It's taking a lot of information into account and weighing up the options as to what's going to be best for you and your child. The upside with these treatments is you can always change. It's easier to change from some than it is to others, but you can change these treatments. If something's not working right for you, you maybe have to self-advocate and go to your consultant and tell them what it is you're looking for, and hopefully you should be able to work out the right regime for what you want to do or what you want for your child with the bleeding disorder as well. So there's so many options there that you can do, and that's as much as advice as I can really give on that. I see some other people have joined. Thank you for jumping in. So just seeing, I'm actually running on Facebook now, so I finally figured it out. Again, I do apologise for people that were looking to join and my crappy technological skills. Has anyone else that's jumped in got any questions that I could maybe answer? And I will say happy Easter to everyone. I didn't realise it was Easter Monday when I set this date, so I do apologise, but I do appreciate everyone that's joined so far. Okay, so I've never learnt veins, but my 8-year-old has a port. Ports are difficult. I've never had one. I was offered one, and my mum decided to go against it. I've spoken to a lot of parents whose children were on ports, and has found moving to the subcut injection much easier, because you're not faffing around with veins, and the timing of the injections is much less invasive. I'm on every fortnight. I do an injection now, so it's a far cry from doing it every day. Have you ever been offered any alternative treatments? At 8 years old on the port, is it severe A that your child has, I'm assuming? Becky, if I've got your name correctly. But again, you've got to do what you think will be right for him. If the port is working, then maybe continue with that. But there are other treatments that you could also try. And like I said before, I firmly believe that the subcut is fabulous for the younger people with haemophilia. Severe A, yeah. So I'm not a doctor. I'm not a doctor, but Hemlibra would maybe be something worth looking into, because it is much quicker. And from the people that I've seen have ports and have the injections with ports, I know there's a lot of prep that goes into just getting that injection done. Whereas, intravenously it can be a lot quicker if you can get the veins, and obviously if your little lad will sit still. But again, with subcut, it's kind of in and out, and that's done. So it might be worth maybe speaking to your consultant about with that to see if it's an option, and then weigh it up from there. But it is certainly something I would recommend given the right circumstances. But thank you for the question. I hope I've answered it adequately for you. I've had some. These two screens are going to confuse me. I can already tell you now, so I do apologise. Thank you for joining us, Leela. Happy Easter to you. Quite happy with the port. People are, like I said, you've got to do what works right for you. So if it works, then crack on. As long as you're getting the cover that you need, that is the main thing. If you're covered and can do everything that you want to, that is all that matters. It's irrelevant of what treatment you're on. It's all about the right regime and what works for you. And as you get older, you might actually change what treatment works. I've changed multiple times to find the right one that suits me. So you've always got those options. Okay, wondering if you still have time to learn veins. Always got time to learn veins, I think. And I'm sure if you speak to your centre, your consultants, they should hopefully assist. I know when I started prophylaxis and treating from home, one of my mum's biggest concerns was injecting me and not knowing how it felt to do the actual injection. So she actually got needles from the centre and practiced on herself. My dad did the same, so that they knew what they were doing, and then eventually when they were comfortable enough, they started treating me at home. So I believe that your centre would more than likely help you with that, and out of all the consultants I've spoken to, they've always been very keen on ensuring that families that go onto that treatment do know how to do the intravenous injections as well. So I'm sure that's something that you could learn, and that people will certainly help you with as well. And obviously it saves you the journey from, it could save you a trip to the centre. If you had a bad fall, you can do the treatment at home and hopefully avoid that situation completely. We've actually got quite a few people joining on either side, so thank you very much for joining in, guys. I really appreciate it, and hope I'm not disrupting your Easter too much. I was supposed to do this in January, but lockdown, I had nothing else to do and just didn't get round to doing this, so I do apologise. It's one of those when you've got nothing to do but you can't be bothered to do anything else, so it can be a little bit awkward. But no, thank you very much for the questions so far. Is there any other questions out there? Any other people that I can... anything that you would like me to talk about that I've completely forgotten because I've stuck two cameras in front of me and gone like a deer in headlights and forgotten what to say. So yeah, if you've got any questions or anything you want me to kind of touch on, then I'm more than happy to. I did have a few things in mind, but like I said, I've gone completely blank now. But yeah, so thank you for joining. We've got a few more people. This is great. I've had a better turnout than expected, so yeah. But like I said before, it all comes down to what's going to work for everyone in terms of treatment that works for you. I think I've actually frozen on the laptop, so Facebook might not be a goer today, so I do apologise. Oh no, we're back on. We're all good. We're all good. Another thing that I wanted to talk about in this live stream was, mental health, really. Something that I thought about, and one of the main reasons I didn't really get round to posting, something that I'm working on with the Haemophilia Society. I'm in the process of learning more about mental health and how to deal with it and how to help people going forward. However, half the reason I haven't actually posted stuff or anything like that is lockdown and not having the right mentality to actually come out and talk to people, when ironically the biggest thing is talking to people. So it's all about helping other people in that aspect. So that's something that I'm more than happy to talk about on this kind of live stream as well. But anyone that's joined, does anyone have any questions that I can maybe try and answer for you here? Whilst maybe some people are going to join. Okay, fantastic question here. Any ideas and stories on pain management with arthritis? Mental health department, like dealing with everyday pain. Thank you very much for your question there. See, I've got arthritis in both my hands, and I've tried everything in terms of pain management. I try not to take any kind of painkillers like paracetamol or anything like that. purely because I don't want to overuse them, and I don't think that they work too much for me anyway. To the point where I take anti-inflammatories for my hands. I mean, mental health. I've had days where I've had bleeds and I didn't want to get up, didn't want to leave the bed, or didn't even want to do my factor for that part because everything was just for me too much and too depressing. Where the biggest thing that I found was accepting the fact that as soon as I kind of accepted the fact that I do have this blood disorder and I do need to take my medication in order to make me feel better, as opposed to ignoring the fact that I have a blood disorder, that's when everything changed. I had a point where I spent 3-4 weeks on crutches with a massive bleed to my leg, and the bleed was purely the result of I had decided to stop doing my treatment. I decided to stop doing my factor. I was about 16 years old at the time. I felt so different from everyone else because I was doing my injection. So I thought, well, if I don't do my injection, I'm the same as all my friends. And it wasn't until the bleed got that bad where I couldn't walk forwards, even on crutches. I had to use them to drag my leg backwards, where I realised that I needed to take control of this condition and treat it properly. And as soon as I did that, my complete mindset changed and I started to get better. It took me a few years to get better, but I did start to get better with it. It's just having the right mindset. It's impossible to get the right mindset unless you really want to, or you can understand why. I mean, everyday pain, I've accepted the fact that my hands are sore. It's just something that I've got used to. But as long as I can prevent anything else from getting that bad, then that's a win for me. So that's what I try to do. Yes, and this live stream will be saved, so you will be able to view it later for anyone who's missed it, or if you want to watch it again. So yeah, no, it will be saved. And thank you again for that question. That was really good, and I hope I've answered it. If you want me to elaborate more, then by all means, let me know, and I'll see what I can do. Hello, Luke. Thank you for joining us as well. Thank you. Let me know if you've got any questions. I'll see what I can do. Again, I do appreciate everyone for joining this live stream. It's been a long time waiting, so thank you very much. And I'm hoping both these streams are working. I'm actually not too sure. I know the Instagram's working, and I'm slowly getting a trickle through Facebook. So hopefully we're doing all right. And I've just had someone else join. Thank you for joining. Out of interest, where the people that are watching this video, where is everyone from? Do we have? I know we've got someone from Canada. Thank you very much. Do we have any other people from UK or other parts of the world? Be interesting to know who I'm speaking to as well. Oh, someone else joining. Thank you very much. But for the people that are here that don't know me, just to give you a little bit of background, Glasgow. Good lad. I'm originally from Scotland myself. I know the accent doesn't give it away, but good lad. Haemophilia B, and he isn't on the move yet. If you haven't any distance. Haemophilia B. One of my closest friends has haemophilia B. Poland. Wow. Nottingham. I love Nottingham. Nottingham as well. One of the best nights out I've had in my life is Nottingham. So severe A with inhibitors. Ooh. With inhibitors. Okay. Yeah. I know a lot. I've never had inhibitors. Fortunately fortunately for me, but I know a lot of people who have had inhibitors and have had a lot of issues with treatment, and again a lot of people who've moved on to Hemlibra and just found that the best option for their inhibitors. So it'd be interesting to know what treatment you're on as well, pal, to be fair. But no, yeah, severe rain. Ireland as well. Wow. Oh, we've got some more people joining. Fantastic. So many people. This is I'm really chuffed with this. Sorry. Completely forgot what I was on about now. Yeah, as I was saying, just to give a little bit of a background about me for the people who don't know. I'm 29. I've got severe A. I was diagnosed at 8 months old. So part of what I'm doing at the minute, I'm an ambassador for the Haemophilia Society and Unclottables, like my little side project, essentially, so I can speak with other people who have bleeding disorders and get involved in the community and try and share my experience of growing up with a bleeding disorder and the different treatments that I'm on, and hopefully just share with people and get to know other people in the community. So let's have a look. Thank you. Another person's joined. Thank you, guys. Hemlibra once a week. Fantastic. Fantastic. How are you finding it? I found the change to subcut very difficult. It's still taking me a little while over a year to get used to it. So, but I imagine it's working much better for you, mate. So, I hope it is. Fair play. Well, I've got a nice mix of places. Well, I say places around the world. Different people. It's good. It's good. So again, for people that have just joined my live Q&A, thank you very much for joining. And again, it's I'm here to talk about my experience moving to Hemlibra, growing up with a bleeding disorder. The mental health aspect of having a bleeding disorder, things it can do, the boredom of lockdown, and just to have a conversation. So thank you for coming out and I say coming out. Thank you for logging on and joining my my live stream. So as I said before, I'm trying to do it on 2 different platforms, and I'm hoping it works. Okay. Ooh, I've been hit with a question on each. Okay, so. Look. So it's taken a year to get used to it. Does it hurt, or is it just the idea if you've had to get used to it? It doesn't hurt. It doesn't hurt at all. The main thing for me is I got so used to doing my injection intravenously that to the point where I could do it with my eyes closed. It was just so comfortable, and everything that could have gone wrong has gone wrong in my 20 plus years of doing that injection. So I was so comfortable with whatever outcome could be. With the subcutaneous, there's not much that can go wrong. It was just something that felt very alien to me because it was so new. So it doesn't hurt. It was more just the fact that it was a brand new injection and injecting somewhere entirely different, and I almost missed I spent loads of days thinking I'd forgotten something because I'd gone from daily to every 2 weeks. It was a lot for me to mentally get used to and realise that I could do a lot of things without having to have an injection first. So that's why it's taken me so long to kind of get used to it and acclimate myself to the new treatment. I hope that kind of helps. And I like to think that if someone's younger, like when I was younger and got bounced between different regimes and things like that, that I didn't really notice. I just kind of went with it. So I think it would be something similar if you were ever to put your little lad on it as well. Someone is currently on a lockdown every other day for his port. He really hates his treatment days. I can understand that, especially at 6. My parents used to bribe me on treatment days. I'd get a new toy or some sweets or something. They used to really bribe me if I didn't want my injections, or if I had to go to the haemophilia centre. Whatever they had planned for Christmas was coming out early just to keep me sweet. But again, if it's covering him, and hopefully as he gets a little bit older, he'll understand why he's having it. So it's really difficult at that age to kind of get them to understand what the treatment's for, I suppose. Very different in 3 years, no bleeds, life changing. Arthritis, man, I feel you. I mean, like my hands are absolutely knackered. I had to give up a career because of it. But I also understand the difference, and no bleeds. I imagine it'll be massive for yourself. So yeah, it's just arthritis. It's a tough thing to treat as well, especially managing pain. So yeah, I do feel it, pal. Okay. Do you mind? With the Hemlibra, I inject it in my stomach. I did try my leg, but unfortunately I've got the skinniest legs in the world. So there was like no fat to inject into, and I just ended up hurting myself. So I have to go for the gut. But it's a painless injection. Absolutely painless, and as long as like the syringe is the right size, there's no uncomfortableness of injecting into it. So it's very good. Injection. Yeah, no, completely agree with that. Intramuscular, absolutely fine. Subcuts, even easier. That's it. So yeah. So do you have two 6 and 9? Do you have 2 children with bleeding disorders then as well? Any joint improvements since on Hemlibra? Touch and go, to be fair. The first few months I noticed a lot of stiffness whilst I was getting used to it, but so it also allowed me to be a little bit more active. So again, it's trade-offs and swings and roundabouts. I do find some of my joints are easier. I think it's more dependent on the extent of the damage that was done to them beforehand. Before going on to the treatment, I do find most mornings I'm less stiff than I used to be. So yeah, there is some improvement, but it can vary again from person to person. Cheers for that, Luke. That is what it is. That was many moons ago. I'm onto a lot of different stuff now, so thank you. But yeah, it is what it is. And again, it's like having the right treatment in place early on to prevent the joint damage as you grow up, so that it shouldn't have to have those impacts. And like I said before, we're in a very fortunate position that we have all these treatments available to us. We have this choice to find out the right regime, the right routine, and everything that's comfortable for us and for your children as well, to make sure that it all works for them. So it can be a little bit of a gamble, and you can go on to something that might not work straight away. Within the first 5-6 months of Hemlibra, I was seriously debating switching back to switching to an extended half-life, and my centre had created a plan for me to switch to that treatment, but I ended up persevering with it and seeing what would seeing how it would work, and lockdown obviously had a massive impact on that as well. And now I've got to a point where I'm incredibly comfortable with the treatment, aside from not liking the injection, but it's once every fortnight, so I can get over that. And crack on. So it is working, and it's just a case of seeing how long it will last before, unless I decide to switch to something else. We've got so many new treatments on the horizon, with the likes of gene therapy, and other things that will hopefully come out in the future. Who knows where we'll be in 5 years' time and what will be available to us. It's very exciting, and I keep saying that it is. If you're ever going to have haemophilia, up until this point now is the best time to have a bleeding disorder, because of what we have available to us. It truly is outstanding now. I remember being younger, and the only treatment we had was the standard half-life in the UK, and you kind of got what you were given, and that was it. So to have these these 3 main things that you can choose from is especially for people with severe A, is remarkable. It's unreal. So no, we are in a very, very good position. So what we got here? Sorry if I kind of waffled on there a little bit. I do apologise. I'm just trying to answer everyone as much as I can. But yeah, is there any other questions we've got here? Tattoos always come up. No, I've had no implications with my tattoos. I got my first one when I was 17, and I got it done on my treatment day. It wasn't a big tattoo or anything like that. I sat for about 40 minutes, and to be fair, I didn't know what the outcome would be. And after it was done, I realised that I didn't bleed too much, and I didn't die. So after that, I started getting more and being smarter. With my treatments. I'd sit for a little bit longer. I'd ensure that I took my factor half an hour before, and the bigger the tattoo got, I would maybe take a double dose. I think the longest I got, I sat for 7.5 hours, to the point where I took a double dose beforehand and then took a dose after, because it was quite a big tattoo. You know, a lot sitting there for a long time, a lot of bleeding. But even since moving to Hemlibra, I've had 3 tattoos, and I've had no issues at all. I mean, I'd always recommend speaking to your centre if you're ever debating a tattoo, but I've had no issues whatsoever, and I'm planning on getting more, and having piercings and things like that. That hasn't really had any issues, providing I had the treatment beforehand. And yes, not dying is, it's always a bonus. That's what I aim for, really. Any upcoming therapies that you're particularly excited about? The main one for me, that I kind of go back and forth with, is gene therapy. I know a few people that have had the treatment, and it's been very successful for them. So that's something I'm keeping my eye on at the minute. Again, they're still in the trial phase of that, so it's still going to be a little while off before that's available for anyone wanting it without partaking in a trial. But I think it will be a game changer going forward for a lot of people with bleeding disorders. And every time I speak to people, there's always kind of something new on the horizon, or different variations of subcutaneous injections and longer lasting factors. So there's going to be plenty of stuff, hopefully, coming out. But I think the big one for me is gene therapy. That excites me the most. That's the biggest one. Let's have a look. Severe A. Sister Marde. Ladies that you can follow on Instagram. Ooh, I know a few. I can't remember their Instas off the name of my head. But what I'll do, if you don't mind, I'll send you a message after, Bex, with the people to follow. So, but I do know a few women with bleeding disorders that would be good to follow. Definitely, I can certainly get you in touch with them. I can do that. Definitely, but yeah, it's worth looking into that, because at 16%, that's very low. So yeah, no, definitely. Let's have a look. Do you do any regular joint care, yoga, stretches, exercises? I have some physio exercises from the physio that I see at my centre that I would say I do. I'd be lying if I said I did them every day. I do them when I'm told to do them, and then after a few weeks I kind of forget about them. I do have hand exercises that I do more often, purely because of the arthritis. But in terms of actual exercise, the most I really do is I play golf, so I get a lot of walking in. I walk daily, I did the virtual London Marathon last year, not to the best extent, but I'm also hopefully doing the proper one this year, so it'll be proper running training that I'll be doing within the next few months, get that going as well. But yeah, as far as regular joint care, I have to admit I'm a little bit too lazy for that. I try and be as active as possible without it being as regimented, if that makes sense, because I do kind of get annoyed with it. Hem Libra and sports or condition trainings, any opinion? I think Hem Libra, you can do most things. There's certain sports that I would always recommend against, that I wouldn't say go and do UFC or boxing or anything like that. However, you can do most things on Hem Libra or with any treatment that's available to you. Really, it's all in moderation, not pushing yourself too far. I mean, I know guys on Hem Libra that do weight training. The chair of the Haemophilia Society, he's got severe haemophilia A, and he runs marathons. He's competed in triathlons and Ironmans, so it's all about having the right regime of treatment and the right training as well. So I think with the right treatment, regardless whether it's Hem Libra, standard factor or an extended half-life, you can do whatever works and work your treatment around your training, or vice versa, to make sure that you've got the best to cover. And thank you for that, Luke. But yeah, I hope that answers the questions we've had so far. And Bex, if I do forget, send me a direct message after this, and I will give you the link to the women to follow with bleeding disorders as well. Thank you very much for joining, guys. Just realised that I've been rambling on for over half an hour, so I'm doing well so far. Do we have any other questions? Anything else that you guys would like me to talk about? Obviously, I don't want to bore you all and keep repeating myself as well. I'm glad that some people have come out to listen to me ramble on for over half an hour. I am going to start posting more regularly on my Unclossable page, and try and create the best content that I can for everyone. It's obviously just a case of finding out what everyone actually wants to know and will listen to, and having the time to do so. Once we all hopefully get back to normality in the coming weeks and lockdown starts to ease around here, I know I'm not the only person looking forward to the pubs opening and going back to work, so hopefully we can all get back to normality that way. But yeah, do we have any other questions that I can answer? I know we're dropping a little bit on here. It's getting a little bit late in the day. I'll hopefully be posting some more content for World Haemophilia Day later this month. Not too sure what I'm going to do yet, but hopefully I have something together. If you've seen by the society that they're putting some stuff together as well, so we can hopefully celebrate a day for people with bleeding disorders, because although I talk about haemophilia a lot, but there's more than just people with haemophilia affected by bleeding disorders. And as you know, in the comments or on Instagram, women are greatly affected by bleeding disorders and often overlooked by it as well. which is something that we are trying very, very hard to highlight their experience and ensure that the advice and experience and help is there on that side of things as well. My mum and my sister were both diagnosed as carriers of bleeding disorders, when really it should be women with bleeding disorders, because they are affected by low factor levels as well. So it's something that we're all aiming to achieve and talk about and raise that awareness. And the whole point of this Q&A and talking to everyone is to raise awareness for bleeding disorders in general, and to know that I'm always here for one, to answer anyone's questions. If you ever want to send me a message or anything like that, I always strive to respond to everyone that sends me a message, and just to raise awareness. The one reason I wanted to start Unclottable and do things like this is because I struggled so much not having any kind of outlet or anyone to speak to when I was younger. So I really wanted to be in a position where I can talk to people and give my experience and advice as and where it may be suitable. So I do thank everyone for joining in on this and listening to me ramble on and listen to my experience. So it's really great to speak to everyone here. It does feel a little bit one-sided, staring at two screens and reading text, but it is amazing. So no, I do enjoy it. So thank you everyone for that has joined in. I know we're getting a little bit dry on the questions here, which is absolutely fine. If unless people have any more questions to throw out at me, I might call the end of this stream for now. But I will endeavour. Oh, here we go. Level 27. Wow, that's 18 months old. Okay. Yeah. Sort of the first year, 2 years is, especially if there was no knowledge of bleeding disorders in the family. That kind of makes sense. 27 is a very very low level, to be fair. Again, like I said, I would say pursuing a woman with a bleeding disorder as opposed to a carrier. So again, I'd be interested to know if you're involved in any of the women's groups that the society has, and if not, it might be you might find it very interesting to see the type of stuff that they're working on. But yeah, how did you find out, like, what made you get him diagnosed, if you don't mind me asking? That's very interesting to hear, actually. And apologies to everyone that can see my golf clubs in the background. I forgot to move them. Thanks again, Luke. Cheers for joining in, mate. No? Okay. Right, as we're going a little bit quiet on here, again, thank you for letting us know that, Claire. If I'll hang on a little bit to see if you come back to me. Oh, someone else has just joined. Hello. Thank you for joining. We're maybe come to the close, unless people have any more questions for me in regards to bleeding disorders in general. Oh, here we go. Yeah, that sounds very familiar. A lot of GPs don't tend to know to test for bleeding disorders, unfortunately. So I was diagnosed at 8 months old. My mum had an idea that we had haemophilia in the family, And it wasn't until I was put to bed one night with a bruise the size of a pea, and she got me up the next morning, and it was the size of a fist that they took me to get diagnosed. So I imagine it must have been a bit of a long, painful time to find out exactly what was going on, to find out that it was haemophilia, because if it's known like in the family history, then they can do it by heel prick fairly quickly. But yeah, if you don't know about the condition, then it can be a lot of rigmarole to get that test done to find out exactly what the condition is, especially if you don't know what you're looking for. So I do feel for you there, but the upside is you know what's going on now. So, but yeah, right. Okay, guys. Been on it a little while. I'm happy to carry on if we've got some more questions. If not, I will call it a day. This is going to be saved on Facebook at least, so you can all come back to it. And again, if anyone wants to get in touch with me, well, here we go. So I was diagnosed at 4 months, so twin sister tested, so no need. No, well done, yeah. No, twins, exactly. So, yeah, you should have insisted. So, yeah, you've done the exact right thing there. 16%. No family history either. That's becoming more and more common, that, to be fair. But, yeah, it is about... You've done the right thing. You advocated for your little ones and got that right. I mean, I know people that... Well, my sister, for example, I was diagnosed haemophiliac, and I'm the youngest, and it wasn't until she was, late 20s and pregnant that she found out she was a carrier. So a lot of people do go through life not knowing, especially women, not knowing that they do have a bleeding disorder. Bumper's cheek. Oh. 5 years on? No, fantastic. 5 years on, not too bad. That's it. I applaud all of the parents, mothers out there dealing with young children with bleeding disorders, because I couldn't imagine what it'd be like to look after a child with a bleeding disorder. I see it as something that's easy to deal with because I've grown up with it. But especially when you're very new to the condition, I can't imagine how daunting that might be. So well done to all of you who are doing it. But the upside is once you do have a handle on it, and it can be done, and you can find the treatment that will work for them. So it's all about just understanding what it is and what you can do. If a port's working, then crack on with the port. And as he gets older, you will find he'll find what works for him as well, and what works for his lifestyle. So no, definitely. I said I've never had a port, and the thought of one now, I'm just not a fan of them. But again, if they work, then go for it. You need to do what works and what allows that treatment to be administered. So no, that's good. That's good. I'm sipping the coldest brew right now because I've been sat on it for ages. But thank you everyone who has joined in on this today. Though it's very daunting when I'm going to do a live stream, and you worry before you go live that no one's going to join in. You have no one to talk to. So I do appreciate everyone that's come out and asked me questions and got involved. I hope what I've spoke about today does help in some way, and again, like I said before, if you do have any questions going forward, don't hesitate to send me a message. I will be doing more of these, hopefully a little bit more consistently, when we've got more things to talk about as well. But like I said before, these videos will be saved, so if anyone wants to go back and go through anything that we've spoken about, then it should all be there for people to join in. But at that point, I think it might be time to call it a day and let everyone enjoy the rest of your Easter Monday. But again, thank you everyone for joining me. Apologies for the hiccups at the start. I now have a 5-minute live stream on my personal Facebook that I need to delete. But again, anytime anyone wants to ask me any questions, anything I can help with, do not hesitate to give me a message. But thank you so much for coming and joining me this evening. Take care everyone, and I'll hopefully speak to you all soon.